Through the process, then we can recommend this place. Hallelujah. And especially those of us who live here. We know that this is a problem that we are handling. We know that this is a problem that we can call, like Paul said, he has a thorn in the flesh. We can equate ourselves to the situation that Paul was in and say, we have a thorn in the flesh, we thank God for this facility. It is probably now this that is going to help us. So may the Lord help us. May the Lord bless you, Madam Director. May He continue lifting you up even to higher heights. It is for us that this has come. It is for our generation and our children, children's children. And as I have said in that prayer, it is God who works in us to will and even to act. For what reason? That His purposes may be realized. That is in Philippians chapter 2, verse 13. And that is my prayer, that His purposes concerning this facility and the people of this country and the world may be realized for His own glory. In the name of the Father, the Son, and of the Holy Spirit.
Whatever God says and promises, it comes to be done. Don't think you are supposed to be anywhere else today. It is here. When God created, He put in His diary, you who is here is supposed to be here today. And why are you here today? To encourage our young men. Because this rehabilitation center is for our men. It's only males, although we also have to take care of the females. You are here today to encourage them that you can make it. We always say in this center, if you look down, that together we can make it. Anytime you feel you have information, anytime you feel that you want to be helped, because we have also day out patients, feel welcome.
Stand before you today on this auspicious occasion to officially open Stegrami Rehabilitation Centre. This center has been a long time coming, and it is with great pride that we open our doors to the community to provide much needed services for those struggling with mental health, drug and alcohol disorders. Stegrami Rehabilitation Centre was founded in March 2022. This male-only facility primarily aims to provide comprehensive care for those battling with addiction and mental health issues. We understand that addiction and mental health disorders can have a profound impact on an individual's life and the lives of those around them. That is why we are committed to providing necessary support and resources to help individuals overcome their struggles. We have assembled a highly skilled team of professionals as staff of our facility. Our team consists of licensed counselors, psychologists, psychiatrists, chefs, and security. They are dedicated to provide the highest quality of care to our patients. Our facility is equipped with state-of-the-art equipment and technology to ensure our patients receive the best possible care. Our services include individual and group counseling, family therapy, detoxification, medical management, and aftercare support. Currently, our rehab center is for male patients. However, we have a growing list of female patients in need of the same service. We are ready to set up female rehab center if we get more resources.
At Stegrami Centre, we offer professional services that are tailored to meet the unique needs of each patient. Our team of highly trained professionals are dedicated to provide a safe, supportive environment where patients can receive help and care they need to overcome their challenges like addiction and mental health disorders. Our services include and not limited to outpatient and inpatient drug and alcohol treatment, drug and alcohol detox program, medically assisted treatment, therapy, e.g., dietary therapy, physical therapy, counseling for mental health, such as depression and trauma, individual, family and group counseling, life skill training, community outreach awareness programs, mentorship, relapse prevention, aftercare program to patients in recovery, and support services to the family who have those patients here.
I'm a software engineering student, but today I'm standing in front of you as the chairman of Stegrami Rehabilitation Centre and an addict in recovery. I am now on the path to recovery, and I owe it to the support and care of people like you. Today, I'd like to give a first-hand account of addiction. I am a recovering addict, lucky enough to get an opportunity to leave my own life behind and join a rehabilitation center like Stegrami Rehabilitation Centre, a place I now consider a second home. During my stay here, I have come to understand that addiction is a disease, and just like any other disease, it can be managed and fixed. Being frank, addiction is slowly becoming a pandemic to our community. I'm sure everybody here knows an addict, be it a relative, a neighbor, or a friend. If that is not a red flag, then I don't know what is. As I'm a testimony before you, you can see I'm stable right now. I wasn't the same way when I entered that gate 3 weeks ago. So I'd like to give thanks to God for that, and also give thanks to the administration of Stegrami for giving me the opportunity to be here. I really don't take it for granted. And for our therapist and psychologist for the sessions that he's been having with us. It's a real eye-opener for us to realize that even though we were addicts, there are some things that were pushing us to the addiction. So I'd like to challenge everyone here to at least go and find out more about the addiction and see you in the position that you are in, what can you do to help another addict?
It's a big problem to us, and we are really trying. As a government, we are really trying, but hatutachoka. Lakini mimi nataka niseme kwanza, iko tabia among our business people, especially who do deal with alcohol. We are affecting the lives of our children. Na inakuwa hivyo. And that is why children end up in the stages of drinking alcohol. Wakipicha wazazi kidogo kidogo, alikuwa amekuwa totally addicted beyond reprocation. Sasa ni kwanza kuongelea mambo ya rehabilitation center. Hiyo ni gharama ingine. Let us take care of our community welfare. That one we call conducive environment for business. Kuliko maneno inaleta kwetu tunakimbizana kila mara tunakimbizana.
Jambo, I'm from Kiambu County, Ngoingwa specifically, and I'm a recovering addict. I came to Stegrami Rehabilitation Centre to battle with addiction, and so far the journey hasn't been quite easy, but at the same time it has been okay. I've been receiving treatment, detoxification, and counseling, therapy, and so far I can say that I'm getting stable. The journey is still long, but I'm at least we're headed somewhere. I've been an addict for 7 years, and for the past 5 years, I've been using daily without skipping a day. Yeah. Drugs only lead to 3 things. That is jails,
institutions like this, and death. So among the three choices, I think the one choice that is better for you to choose is to go to an institution like this. Just admit that you have a problem with using, and from there, I'm sure once you're willing to come out clean, you can never lack ways of being helped to come out and be yourself, because the future is quite young. I'm young, I'm 25. I wasn't able to complete school, but right now I think I even have a chance to go and complete school. At this rehabilitation place, it's a serene environment where I get to have like a long time reflect alone and with my therapist. Helps me a lot figure out a lot of things. So you get to look at your past life, the things you used to do wrong, and you look at your future. And by looking at your future, you come to realize that you're still young, you can still achieve a lot of things. So it's never too late to turn from your old life. At any point in life, you can just turn, and at that turning point will be the turning point of your life. I can call drug abuse a pandemic right now, because the availability of drugs these days it's very readily available, and I think the community has just accepted it, and there's nothing much being done about it. The situation out there, it's not good. Yeah. The appeal I can make to the society is, the community in total is, you need to understand that addiction is a disease, and just like any other disease, addiction can be treated. So the addicts you're seeing at home, they are sick people, just like the way you can have a patient who, or a relative who has cancer, who needs treatment. So by that, you should be engaging them, trying to make them get help, and also you guide them once in a while where you're able, and if you're also able, support them, because most people who use drugs out there, they don't use drugs just for the sake of using drugs. They use drugs as a coping mechanism for their daily stresses in life. And as at now, you can see the unemployment rate is very high. Many people, the dropout rates in school, it's also high. Some people just drop out of school plainly because of lack of school fees. Someone gets into depression, and they don't have the right person to talk to about sad things. So that's where you find someone bottles up the feelings they have, then they direct it to drug use. So by using that drug, they're able to shelf what they're feeling inside and find a coping mechanism.
My name is Jeremy. I am a recovering addict. My journey was tough when I got over here because I didn't have the capability to accept things. I was in a denial management. I was not sure what to do, but having this, I don't know, just the chance to get to have a rehab, it's so nice for me to see a better future of myself, and it's a representative of me and to other people. Mimi maisha yangu nikiwa nje ilikuwa that easy, sababu nilikuwa na struggle kutafuta hizi drugs, ilikuwa difficult. Mtu akijaribu ukitafuta drugs, ukipata the taste of it, you just want more and more and more. Na hiyo drug uking'ang'ania ndio unaendelea kudevelop venye unasikia cravings, na venye nimekuja hapa nimeona a big difference to how my life was. Yeah. Naweza advice to in my own understanding. Si lazima niko nimesoma ati ndio niwaambie, lakini nawaambia tu mayouth mwachane na madresi poa. Ile kitu kingine nitasema kwa hayo tu, unaharibia vijana life. Wakati mlivote.
My name's Michael Wamaiweru. This rehabilitation center called Stegrami Rehabilitation Centre came from a long time ago when we used to do community service to people, because we used to deal first of all with AIDS-related issues and poverty, and also street children, things like that. So in as time went, we along the way we've lost friends, relatives, and we saw a need or a gap in the community we live in here at Ngoingwa Estate, Thika. And we open up a rehabilitation center that would help us cater for the community at large, those who are affected by drugs, alcohol, and mental health, so that we may help them to be better people in this country. For now, we are catering for males, and we hope in future to cater for females, to open another center for females, and also do more branches as we grow. Notably, criminal activities are heightened when people take too much drugs, people lose their lives still, and also people affect their families in different ways. Suicide cases are on the rise, divorce cases, battery. So we try our best to reduce this with this rehab center here, that we hope that will help people be better people in the society. The capacity at the moment, we can house 12 inpatient, but for outpatient we can cater for both male and female. But for now, our center is housing 12 male inpatients. Yes, the challenges, number one is our patients. Some of them are not well off, and they do need rehab services. So you find that some of them are unable to pay for the services, and that's also a challenge to us, because we want to help, but we have things to pay. And another challenge is also funding, because running the center is not cheap and it's not easy. If there is a kitty in the CDF for such people, and also NHIF, they have said they do cater for rehab services up to 60,000 when you have NHIF card. We ask them for their help, also from NACADA. Whatever way they can help us, we accept.
Vincent Mokaya. I'm a resident psychologist here in Stegrami Rehabilitation Centre. To start with, maybe I can explain about a rehabilitation center, because most people have not yet realized or understood what really addiction or rehabilitation means. When a client is undergoing through addiction or mental health issues, they experience something we call imbalance of mental imbalance. So what we do here in a rehabilitation center is to try and bring them back to the balance that they need, so that they can sober up or they can live a productive and a healthy life. In a rehabilitation center, it is changing of behavior or changing of thought patterns of this person who has been exhibiting that he thinks that is the right channel to undertake. So we try to bring them back to their let me use normal in quotes. We try to bring them back in a state that they can see the problem that is ahead of them. Because these drugs or this alcohol use, it prevents them or it hinders them from thinking beyond that. Kama kawaida, globally and nationally, ile wakati ambao umetengwa kwa mtu kukuja hapa rehabilitation center ni miezi 3. Na hizi miezi 3 ndivyo anafanyiwa hiyo treatment ambayo nilikuwa nimeeleza hapo awali. Tunamfanyia hiyo assessment ya kwanza. Baada ya hapo tunamfanyia treatment. Baada ya treatment tunamfanyia what we call aftercare program. Aftercare program tunaifanya after every 1 month, which goes for 1 year. So that is 52 weeks. To make sure that huyu mtu ako sawa vile tulimtoa hapa, kwa sababu akitoka hapa tumemfanyia detox ya kutosha yeye. Kwa hivyo tunamaanisha tumemtoa chembe zile za madawa za kulevya ama pombe katika mwili wake. Sasa anaweza kurudi katika hali yake ya kawaida ya maisha. Lakini wakati mwingine tunahitaji either kuongeza muda, kwa sababu kila mtu ana respond tofauti katika hii treatment ya addiction. Kuna yule amekunywa madawa za kulevya na pombe kwa muda mrefu. Mtu kama huyo ukimweka hapa miezi 3 pengine haitatosha. Kwa hivyo unahitaji kumwongezea muda, na kuna wale ambao wameanza wanahitaji tu muda kidogo kuwarekebisha na kuwarudisha katika laini.
Majina yangu naitwa Ephraim Macharia. Mimi ndiye mwenyekiti wa bodi ya CDF Thika Town Constituency. Leo ni siku kubwa, tumefika hapa kwa Grahim kushirikiana pamoja na kuwapatia mkono wa kusaidia na kufanya kazi pamoja ili tujaribu kupigana na mambo ya pombe. Sana sana tukikuja kuona ile kazi wanafanya hapa ya kuchukua wale ambao wameingia kwa madawa za kulevya na hata pia mambo ya pombe na kuwasaidia kubadilisha maisha yao. Ni mambo mingi ambayo inafanya watoto wetu kuingia kwa mambo ya ulevi. Wanamaliza kazi na hawana ajira. So mtu akimaliza na anaona amegraduate na hataki kufanya kazi ingine ambayo hajasomea, hiyo ni kitu moja. The other one is about frustrations. Ile ulikuwa na hope kubwa sana maishani, lakini wakati umemaliza masomo unajikuta ya kwamba haufaidiki. Ya mwisho ni ile njia tunasema ulee mtoto na umuonyeshe njia. Wazazi wengi ni kama tumeacha responsibility zetu, tumeachia wachana pale kazini, pale nyumbani, kila mahali ukienda unasikia mtoto ako kwa mikono ya house girl all through. Ni kama parents, ni kama tumeachiria sana mambo zingine. Kazi yetu tu ni kutoa pesa, mtoto akikuitisha pesa ndio hiyo, hata hujui inaenda kufanya nini. So mimi ningesema wazazi turudi pale tulikuwa kitambo. Nikiitisha 500 na akaunti ni nini mtoto wangu anaenda kufanya. Ya mwisho ni pia watoto kufuatana na watu ambao hawajui background zao. Mimi nimelea mtoto wangu vizuri, lakini akifika juu anakutana na watu ambao ni watukutu, so anachukuliwa na hao watu. Watu wanapenda pesa sana na watu wa huku kwetu wanasema ni wanabiashara. Mtu anafungua kiwanda na anajua ya kwamba sio ya kutengeneza kitu ambao itasaidia watoto wetu, ni kitu ya kuharibu. Ati anasema nimeajiri watu 10 watakosa kazi. Mimi ukiniuliza naweza kusema ya kwamba kuna biashara zingine literally zinatakiwa zipatiwe barua. So ni kupenda tu pesa, sio kitu ingine.